Good afternoon. It's definitely my pleasure to be here. So thank you to Sean and Ian and Steve and the rest of the organizers for this really engaging, thought-provoking meeting. I've absolutely learned a lot. So let's see, without further ado. So I'm not going to talk for long, but what I thought I would do was to give you some examples of some findings for work that NIMH has funded, just to give you kind of a flavor of some of the work that we've been supporting over the last few years. Then talk a little bit about some of the benefits and challenges of this work. That's kind of, actually, it's been nice. Some of these points have already, most of them have already been raised, so I won't spend long on that. I'll spend a little time talking about some of our priorities and then some funding opportunity announcements. So this first slide shows some data from the WISE pill. I don't know if people are familiar with this device, but it's a wireless container that holds antiretroviral medication. And it's been used by Jessica Haber and her colleague David Bangsberg in a number of settings, mostly in Uganda. But this sort of slide shows you kind of the power of real-time adherence monitoring. This isn't true for this presentation, but when I've seen David and Jessica present on this data, they say, you know, here's our data for this woman who lives in Uganda. She's agreed to have her picture taken, agreed for this slide to be used. She lives with HIV, and every time she opens up the box in the morning to take her pill, a little red dot appears. And every time she does that in the afternoon, a little red dot appears. So whenever I've seen this presentation by Drs. Bangsberg or Haber, they've downloaded this information that morning from Uganda. So the data is like 2 hours old. And we've been monitoring adherence for, decades at this point. But what's really powerful about this is that it's in real time. And we know now, too, sort of the how quickly the virus can mutate, how quickly people can develop resistance. So some of this work was partly funded by NIMH, and I think is a nice example of really kind of thinking, really pushing how we use technology to enhance assessment of adherence, of sexual behavior. And really thinking also, I'm kind of jumping ahead to my priorities, but really thinking not just about how we can use, a lot of people are using diaries and I think they're great and EMA is great, but I would say we need to push it even farther, right? We need to push it beyond self-report. How can we collect the data in real time where if I'm not one of those super religious, marking down everything that I eat or all the steps that I've taken, how can that information be collected without me, having to put a lot of effort into it? So this slide shows some of the, challenges and risks of doing this work. This is some data from Jose Bauermeister. He's at the University of Michigan. He has a sex lab. And he's done a lot of work around recruiting young men into studies and then looking at the validity of the data and really making us question all of the data that we collect online. I mean, online surveys, don't get me wrong, they are amazing ways of collecting thousands of surveys within a few weeks. But just getting that data in and going along with what people say is not enough, right? And Jose's really looked closely at this at this question and done some different analyses as to which surveys to include. How do you look for fraud, especially when you're giving incentives, and has come up with some guidelines and some tips. So just wanted to sort of talk about some of the so thinking about assessment and also thinking about methods, right? Then how do we do this work? And it's really important that we look very closely at how we do it and develop guidelines. So I wanted just to highlight Jose's work because he really focuses on the methodologies that we're using for this work. And then I just wanted to touch a little bit on kind of recruitment and surveillance approaches. Actually, Ian has already talked about the Grindr work that he and his colleagues have done with using Grindr for recruitment purposes. So I think I won't go into too much more about that. And then Sean Young has also done some really innovative work looking at Twitter and looking at how how Twitter can be used when people are searching for or making posts, not searching, posting around HIV and substance use, that you can really look for where the HIV epidemic is concentrated. So I know probably everyone here is very familiar with the work that Google has done around flu, right? Google is now able to map the flu epidemic almost better than the CDC is. So I think this brings up some really great potential for how do we look for HIV hotspots? How are we keeping up with HIV surveillance when we know we're looking at all the presentations, our data from 2009, it's 2014, right? How do we improve our data, our HIV surveillance methodologies? And Sean has just recently had a publication accepted on this very point. And then the next few slides kind of talk about some of the work that we fund in HIV prevention or care intervention. So you heard from Brian earlier, so I won't talk about that. You've also heard from Lynn, so I won't spend more time on this. And then Sean's work as well, using Facebook to increase HIV testing in young Black MSM. I don't know if he's going to be talking about that at all, but okay, he's not. So I'll spend a little time on this one. So Sean's done some really innovative work. I think really looking, right, it's important to look at the benefits of interventions online and not just, how can we push out information and reach people where they are, but how can we take advantage of those social networks that people have been talking about. And that's where Sean's work is really powerful, in that it's using an app that many people are going on and using peers to sort of promote HIV testing, and has found some really promising results. This is just another example of Lisa Hightower-Weedman. She does some great work in North Carolina. She's developing this. It started off as an online intervention and has now moved to more of a mobile social networking app for young Black MSM. And and what I really like about this application is that it's not just targeting young MSM who are positive or who are negative. She's like, okay, no one says I only hang out with, positive other guys, you know what I mean? We all hang out together. So what the app does is it really pushes information based on your status. So if you're positive, you're going to have more material that's going to be focused around adherence and about risk reduction. Well, risk reduction is really consistent for both groups. So that's what I like about this one. And Keith Horvath as well. He's done, the reason I brought up this slide is that Keith has developed a online social support intervention for men who are living with HIV, and has found some good effects on adherence. So, I think I'm repeating myself, or repeating what other people have really raised with some of the real benefits and challenges to technology use. We're reaching people where they are. You have a therapist in your back pocket. You can tailor to the individual. I really liked, the work that was talked about earlier with meth users, that you're really targeting those messages to the individual based on their baseline. But we have to really acknowledge some of these other, drawbacks as well, and the disadvantages. And I think we also have to find the right balance, right, between our online and our offline, or our tech interventions or approaches, and our face-to-face interventions as well. I think there's a tendency to jump on the tech bandwagon and think that it's the panacea, right? And it's not. It's another way of doing work. It's transformative. I think in many ways it has been revolutionary, but it comes with its own set of challenges that we need to be very cognizant of. Okay, so where do we need to go from here? I think we need to move from feasibility and usability to impact. I know that's the way NIH is set up, so that you have to sort of do these pilots, but I really push people to think about how we can look at impact in really innovative, novel ways. I like Margarita's work where they're getting kids to refer their friends, and then they're tracking that by looking at who's coming in and how they were referred to that clinic, to really get some hard numbers about the impact that they're having. I think we cannot ask this question, oh, we have this great interventions delivered face-to-face, let's put it on text messaging, let's put it on Facebook. If you do it well, it'll work, right? That's not the question we need to be asking. What we need to be asking is can we use technologies in novel ways? It's just not enough to say I want to convert it to an iPad app or whatever. And lastly, I think, and this was raised as well earlier, we shouldn't be focusing on the platform. It's not can Facebook do X, or can a website, or it doesn't really apply. Anyway, Facebook, I'll just stick with it. We really need to find out what it is. What is it about Facebook that is having an impact on the individual or the group? Is it the shared community? Is it posting? Is it hearing those pro-social or pro-HIV testing messages from peers? So it is going to change. It's going to migrate. Things are going to be different in 2 years, in 6 months. So we can't finish a grant in 5 years and say, oh, my Facebook app worked. That's not moving the science forward. Here's just a list of some of our priorities, and I think I'm out of time. So I think I touched on some of these, though. Really enhancing our ability to measure in terms of our measurement abilities. Thinking about real-time assessment, and also how does real-time assessment impact behavior. I think increasing HIV testing, there's been a lot about home testing. I think we need to know a lot more about how home testing can be used to really drive down the number of young MSM who do not know their diagnosis. And then I think more targeted technology-based interventions for those living with HIV. Actually, there's a great intervention, I forget who was just, I can't find you in the audience, but the woman who was sitting here, NIMH is actually funding a grant looking at women who are living with HIV to help them with HIV disclosure. All right, I'm just going to skip through this. All right, these are, and I'm sure the slides will be available. So these are just some lists of some of our current funding opportunity announcements. These are the 2 main program announcements for the Division of AIDS Research at NIMH. And one really looks at advancing the impact of effective interventions. So that's really, we do know a lot about what works, right? So this is really calling for research to advance that and to really push our understanding of how organizations uptake interventions, what happens when interventions are implemented in the community, those types of questions. And then, of course, we're also interested in looking at the development and testing of new interventions to, improve prevention and also improve the health and well-being of those individuals living with HIV. Oh, and some of them are going to be refreshed, so I included the link there. NIH doesn't make it easy to include links. And then here are a couple other FOAs, and I think Jacqueline might be mentioning some of these as well. So since I'm over time, but anyway, there's a PAR on mobile, using mobile health in low and middle income countries. There's also a program announcement out on trying to increase rates of awareness around HIV status. We saw some of those stats earlier today around 60% of young MSM not knowing their status. So that is a call for R01s in that area. There's some And then there's another call for research on the ethical issues on HIV research, and there's a whole section in that PAR on the ethical issues and challenges around doing this work using new forms of technology. So I think really touching on a lot of these issues. And that's it. Thank you very much.